Paramedicine is a unique domain of practice that represents the intersection of healthcare, public health, and public safety. Paramedics are highly skilled frontline healthcare providers who work within the realm of emergency medical services. They are often the first to arrive on the scene of an accident or acute medical emergencies. They initiate medical treatment for patients in both urgent and non-urgent situations. They must also demonstrate rational problem-solving abilities, provide pre-hospital assessment, and medical care to people with acute illnesses or injuries. In Nova Scotia, emergency health services provide emergency response via ground ambulance or life flight helicopter and fixed-wing aircraft. In addition to responding to emergencies, Nova Scotia paramedics also work in collaborative emergency centres across the province. This includes providing care in nursing homes in Nova Scotia and taking on a leadership role in their community. Paramedics are involved in a variety of preventative programs in their community across Canada. This includes visiting residences and schools to speak about health prevention and educating elderly residents and nursing home staff about certain preventable health crises in hopes of avoiding medical emergencies before they arise. Overall, paramedics are a vital part of our healthcare system. In Nova Scotia, paramedic crews are dispatched through a communication centre in Burnside. Currently, there are over 1,000 paramedics registered in the province.
The paramedic scope of practice is defined by the National Occupancy Competency Profile, or the NOCP. It's broken up into 8 components: professional responsibilities, communication, health and safety, assessment and diagnostics, therapeutics, integration, transportation, and health promotion and public safety. In reality, these components refer to continuing education and professional development, upkeep of safe moving and lifting skills, patient triage in a multiple patient incident, physical inspection and assessment, assessment of vital signs and taking of patient history, delivering oxygen and using manual ventilation, immobilizing fractures, administering medications, safely transporting patients to a higher level medical center, and contribution to public safety by collaboration with other first responders.
Paramedics are trained to treat a variety of medical and traumatic injuries. They can be involved in the transport of critical and non-critically injured patients from different hospitals or nursing homes. The job is not always high-stress situations requiring emergency medical care. There are generally 4 different codes that can be called. Code 1 is a deferrable call, or non-urgent. Code 2 is a scheduled call, which are also usually non-urgent or life-threatening. Code 3 is an urgent call. It is non-life-threatening, but the call requires serious medical attention. Code 4 is a life-threatening call, life and/or limb-threatening. There are many other codes that can be called, but these are the main codes used to determine the priority. When arriving on scene, paramedics make an initial assessment of their patient by checking what are called the ABCs: airway, breathing, and circulation. They first check if the airway is blocked by something, for example, food. Then they check if the patient is breathing by watching their chest to see if it rises and feeling for exhaled air from the nose or mouth. Then they check for a pulse. If all of these signs are absent, the patient is labeled VSA, or vital signs absent. This is a code 4 and requires full emergency lights and sirens. Unconscious patients are immediately delivered to a hospital, being careful not to disturb the alignment of the spine and head, since there is a high risk of head trauma or spinal injury. The paramedic will also check for external bleeding. They can dress cuts or stabilize breaks and sprains. For impaled objects, the paramedic will stabilize the object by surrounding it with extra trauma dressing. To treat a gunshot wound to the chest, the procedure is slightly more complex. The wound is covered with a sealant and taped on 3 sides. The lower side is left open so that the blood can drain out and not accumulate in the thoracic cavity. Respiratory and cardiac arrest calls are among the most critical and demanding. After checking the ABCs, CPR will be commenced immediately, while someone else can grab an AED, which is an automated external defibrillator. These calls have two very definitive possible outcomes and can impose shock and stress on everyone involved. There are usually two possible outcomes in an emergency situation. A paramedic's main job is to improve the patient's situation and well-being.
There are 3 levels of paramedics. The primary care paramedic has the ability to administer approximately 20 different medications, which are primarily symptom relief medications. They are also trained in trauma immobilization, holding C-spine, and use of a spinal board, in addition to some other basic medical care and CPR skills. Advanced care paramedics are able to administer approximately 100 medications, however this varies from province to province. They are also trained in advanced airway management, which includes intubation and surgical airways, as well as other specific skills pertaining to children, infants, and pregnancy. Critical care paramedics are the highest level of paramedic, and they have all the training and qualifications of an advanced care paramedic, plus critical level transportation training and some additional skills that again vary by province. Critical care paramedics commonly work in air ambulances or with police enforcement.
In Nova Scotia, the Office of the Provincial Medical Director is responsible for the development and evaluation of all EHS clinical policies. The most established resource for developing guidelines for the paramedic practice is the Canadian Pre-Hospital Evidence-Based Practice, or PEP. This is a collective effort from Canadian EMS physicians, paramedics, Dalhousie University representatives, and Emergency Health Services Nova Scotia. Most paramedic practices are under the umbrella of Provincial Health Authority, but the extent to which paramedics are self-regulated also varies between provinces in Canada. All procedures are clearly explained in the clinical program documents. They outline how to respond to various situations, from burns, environmental emergencies, to stroke and trauma. All of Nova Scotia's EHS clinical policies and protocols are listed on the Province of Nova Scotia website. Paramedics are trained to provide pre-hospital emergency medical care, which is why it is crucial to get patients to a hospital immediately. Part of their unique training is obtaining their ambulance license, which allows them to drive a certain regulated amount over the speed limit and drive through red lights if it is safe to do so when they are in an emergency situation. Lights and sirens are used to warn other drivers of their location. It is crucial to pull over when you see any emergency vehicle approaching either side of the road you are on. Arriving as fast as possible to the hospital could mean the difference between life and death for a patient. There are many areas in need of improvement in the paramedicine system. TEMA, a foundation that advocates for better mental health support for emergency service workers, estimates that 16 to 24% of Canadian paramedics will be diagnosed with PTSD at some point in their careers. Between April 2014 to May 2015, approximately 44 responders committed suicide in Canada. There is a great need for improvement in terms of psychological support that first responders are receiving. They often don't come forward with their problems because of the stigma that surrounds mental health issues. The amount and accessibility of support for paramedics varies greatly. Mental health support should be equally provided for all emergency service workers. Another issue is that education for paramedicine varies among the provinces. You must go to school in the province that you wish to work in, or you'll have to take extra courses to transfer your credentials. Does this not mean that the care that residents are receiving varies among provinces? Healthcare should be universal. There will always be room for improvement in the Canadian healthcare system. If those who are responsible for bringing health to the community are unhealthy, how can we expect to provide proper care? Once our health service workers are healthy and taken care of, we can provide better care and opportunities for second chances.